Hi, Dr. Kettner. Welcome to Checkup.
Thank you.
You teach at the University of Manitoba. You're a former chief medical officer, I understand.
Yes.
So, what do you think about how we're coping right now?
Well, I don't know what to think, frankly, but I'll tell you what I do think. First, I want to say that in 30 years of public health medicine, I have never seen anything like this, anything anywhere near like this. And I'm not talking about the pandemic, because I've seen 30 of them, one every year. It's called influenza and other respiratory illness viruses that we don't always know what they are. But I've never seen this reaction. And I'm trying to understand why. And I have to say, I really feel for my colleagues that are in public health practice. It's easy for me to sit in the armchair of my office and look at this and observe it and be critical or have ideas. But I really feel for them for three reasons. One is that the data they're getting is incomplete to really make sense of the size of the threat. We're getting very crude numbers of cases and deaths, very little information about testing rates, contagious analysis, severity rates, who's being hospitalized, who is in intensive care, who is dying, what are the definitions to decide if someone died of the coronavirus or just died with the coronavirus. There's so much important data that is very hard to get to guide the decision about how serious the threat is this. The other part is that we actually do not have that much good evidence for these social distancing methods. There was just a couple of reviews in the CDC Emerging Infectious Diseases Journal, which showed that although some of them might work, we don't really know to what degree, and the evidence is pretty weak. So the third problem is the pressure that is being put on our public health doctors and our public health leaders. Pressure is coming from various places. The first place it came from was the Director General of the World Health Organization, when he said this is a grave threat and public health enemy number one. I've never heard Director General of the WHO use terms like that. Then at the announcement of the pandemic, he said he's doing it because of a grave, alarming, quick spread of the disease and an alarming amount of inaction around the world. That puts a huge pressure on public health doctors and leaders and advisors, and a huge pressure on governments. And then you get this, what seems like a cascade of decision-making that really puts pressure on countries and governments, provincial, states, to sort of keep up with this action that was, that Dr. Hoffman said that we're trying to avoid or should avoid, which is an overreaction. I don't know what's an appropriate reaction, but I do know that I'm having trouble figuring this out.
And so I'm sure that your medical colleagues across the country are probably nodding their heads when they say that they don't have enough data, that they lack data. I expect that health professionals around the world wish they had more data, and whether it's the testing rates or the severity rates, all that kind of thing. So probably a valid concern.